Today we are presenting acute care of congestive heart failure. My name is Ann Pearson,
Kimberly Gilbert.
Amanda Dickinson. And Jennifer Denton.
and I'll be starting with the introduction as well as the case study. With our introduction, with congestive heart failure, nearly 5 million Americans are currently diagnosed with congestive heart failure. Approximately 550,000 people are diagnosed every year, and it contributes to almost 287,000 deaths in a year, which is more than any other deaths, including cancers combined. Chronic defining congestive heart failure. Congestive heart failure is where the heart doesn't pump as well as it should. There are two different types. It's diastolic congestive heart failure, where the heart does not squeeze well due to a weakened heart. The diastolic congestive heart failure, it's able to squeeze well. However, due to an increase in muscle size, it's not able to get all the blood out of the heart. Based on this, we did a case study with patient Z, who is married. He's male. He's a 65-year-old African-American descent. He does have a history of smoking approximately a pack of cigarettes a day, a former smoker. He's also a social drinker, has high blood pressure, high cholesterol. He's a type 2 diabetic. His father as well passed away, who had heart disease and passed away of a heart attack. His brother also has a history and has had a stroke. Patient Z, his lifestyle, he's a retired police officer who's 5'8", approximately 250 pounds, which is a BMI of approximately 38.0. He's mostly a sedentary lifestyle, has mostly a sedentary lifestyle. He's obese, and his diet includes a lot of high salty foods. He eats out a lot and drinks a lot of soda. Patient Z presented to the hospital. He lives at home with his wife. He forgot to take his blood pressure medication for the last few days, and he's been experiencing some chest pressure, shortness of breath for the last 5 days. He says he also has a little bit of a cough, which gets worse when he lies down. He feels weaker and more fatigued than normal. And has been coughing with that as well, like I stated. He has noted some increased swelling in both his lower extremities in the last week, and so his wife decided to call the ambulance and send him to the hospital. Based on this, when he came to the hospital, based on his assessment, his heart rate was 116 beats per minute and was irregular. His respirations were shallow, 22 breaths per minute. We listened to his lungs. His lungs were crackly, he was breathing shallow with a loose cough. His oxygen level was 88% with blood pressure of 196/90. His lower extremities, based on his information, was that he had a +2 bilateral lower extremity edema. His EKG showed atrial fibrillation. His chest X-ray shows cardiomegaly with bilateral pleural effusions. His BNP levels were 500, with his BUN and creatinine levels elevated at 35 and 1.4. Potassium was 4.0, sodium 137, and his first troponin was negative, which was 0.0. Presented to the physician gave orders to admit the patient to telemetry and monitor the patient, continue vitals Q4, give the patient 2 liters nasal cannula, maintain an oxygen level of above 92%. He needs daily weights, strict ins and outs, check his AccuChecks due to his diabetes. It's greater than 150 on that scale. It'd be 2 and above, 2 units and above. They also gave him a diet modification, which is cardiac ADA, saying that he's cardiac diabetic with 2 grams sodium, 1800 fluid restriction. Daily labs, potassium sliding scale based on his potassium levels. They're also going to do a troponin 2 more times every 6 hours to rule out a heart attack. They're going to give him diuretics, Lasix 40 milligrams, as well as metoprolol, beta blocker metoprolol 12.5 BID, ACE inhibitor less than 0.5 milligrams daily. They're going to do an echo, a possible stress test, and based on the stress test, they would probably do a heart catheterization.
Okay, in stage 1, patient arrives by ambulance to the emergency department and observed shortness of breath, edema in extremities, EKG readings show AFib, elevated blood pressure, elevated kidney enzymes, elevated heart rate. The assessment, again, to reiterate earlier, is +2 bilateral leg edema, lung sounds, crackles, and loose cough. The LASIK has been ordered for the patient. Shortness of breath, and of course, oxygen is low on room air. Nursing interventions for this would be evaluate urine output in response to the LASIKs. If it's not what it should be, we could call the physician. Encourage oral care every 2 hours for thirst, because we're restricting fluids on the patient, and elevate the head of the bed to help with breathing, and administer oxygen therapy as ordered by the physician. Some questions for stage 1 would be, what would be critical to monitor in patient Z in the first few hours once the doctor's orders are started? Another question would be, if after an hour the urine output is 100 milliliters, the lower leg edema has not improved, heart rate and blood pressure have slightly improved, what would the next step be? And for this, INOs, due to the use of diuretics, is something that needs to be monitored. Heart rate and blood pressure due to medications ordered. The O2 stats, check the patient again, alert and oriented ×3 for any altered mental status. Foley care if ordered to monitor the urine output. Continue to draw labs to monitor kidney function, since baseline labs for BUN and creatinine were high, and continue to monitor the lower leg edema for improvement. On the second question, call the physician and give patient update that there is only a slight improvement with little urine output. Read back and verify any verbal orders from the physician, and explain to the patient and family what measures to reduce the amount of fluid the patient is retaining are not working, so other measures need to be put in place. Also explain to the patient not to consume any extra fluids, and explain that to the family not to bring him any drinks, even though he is probably thirsty and asking for ice water. That's prohibited because we're trying to get the edema off of him, the water retention off of him, and you need to explain this also to the family.
In stage 2, patient Z has already been admitted to the cardiac unit at the hospital. Baseline vital signs have been reviewed, and 3 sets of the cardiac enzymes have been done. They've all come back negative. Since the implementation of the diuretics, the patient is no longer on oxygen and has lost 5 pounds, which is good. He's losing a lot of that edema that's in his extremities. The patient's scheduled for a stress test the following morning. The patient's wife and daughter are bedside, and he's actually trying to talk them into bringing him food from outside, salty hamburgers and french fries. So the nurse needs to walk in the room at this time, and actually, since it's quiet, everybody's just kind of sitting there relaxing, it's a good time to go ahead and do some education with the wife and the patient. Assessment data at this point, he's had a 5-pound weight loss, which we stated earlier. Negative cardiac enzymes. He's actually breathing on room air now, and he's holding at 97%. And his EKG is reading normal sinus rhythm. As far as nursing interventions that need to be carried out and continued, Right now, the diet teaching is the main thing that needs to be discussed with the patient and his wife and family as well. He's going to be on a lot of new medications, so it's going to be important to teach him about the CHF medications and heart attack teaching as well. Diuretic and cardiac, so diet modification, medication teaching, and some other teaching about diuretics. Questions for this stage. The first, what are some essential diet modifications this patient Z should make to maintain his health? The second, what important information should be taught about diuretic use? This will also kind of feed into diet as well. And then the third one would be what home care assessment should be taught to the patient so he can actively maintain his health. The answers for these questions, one, patient Z needs to limit the intake of salt and fast food in his diet. He needs to keep his diet low in sodium, 2 to 3 grams depending on the amount of CHF present and the extent of his disease. It would either be a 2 or 3 gram sodium diet. Food in this diet should be low in saturated fats, trans fats, and cholesterol. We recommend fruits, vegetables, low-fat dairy products, skinless poultry and fish, and nuts and legumes. Answer to question 2. Teach your patient about the specifics of the diuretics. He's at risk for increasing the dose, or about the specifics of diuretics she's taking and the potential risks of increasing the dose or omitting a dose. For example, if your patient is taking furosemide and a potassium supplement, teach them that these two medications are related to each other. So he needs to be careful with salt substitutes because they're high in potassium, and he also needs to be kind of aware of like the foods that he's eating as well, because potassium can be lost with some diuretic, but you can also have a buildup of potassium in the system with other diuretics. And question 3, assessments to be taught should include home screening of the blood pressure, the heart rate, and how to recognize atrial fibrillation. He also needs to be taking some of his daily weights and recognizing symptoms of edema and drug toxicity.
So stage 3. So the patient's already been discharged from the hospital, so now we're kind of looking forward to what does he do when he gets home, what's expected, what are some of the educational tools that we've given him, and has he been compliant with it or non-compliant. So patient Z has actually been attending classes. He's meeting with a dietitian weekly to kind of help figure out what's the best plan for him, meal plan, as he didn't do too well before, so now he's actually wants to do a turnaround. So he wants to know more about his disease and the weight gain. So within 3 months, the patient is actually down 10 pounds. So that's an improvement, and that's going to get that weight off. He's going to be able to breathe better and everything else. He's able to control the sodium intake. He was a former smoker, but he's still learning about how to not continue, and so he's learning cessation and how to quit smoking on a daily basis. You know, it is a hard thing to do. So some other things, he's compliant with his medications, which he wasn't before. We know at least he's trying to stick to the program. So assessments, lost 10 pounds. He's exercising daily. Meets with a dietitian, like I said. He's compliant with his medication, and he's still not smoking, which is a big thing. Nursing interventions. We want to make long-term goals with the patient. What do you want to do for the future? We want to make short-term goals for the patient. You want to set little baby steps for yourself. That way you can accomplish it and feel like you've done something. Provide resources. Maybe he lives with a smoker, and that's why he smokes, or social. So you just want to give him the resources. If he thinks about it, he can have something to help him out. Praise the patient for the goals he's established. A lot of times we say, well, you're not compliant with this, you need to do this, you need to do that. But let's look at what they actually have done and give them a little praise for that. And that kind of helps them with the reward and what they want to do better. Questions we have to long-term goals, like I mentioned. Some meal ideas. A lot of times we hear, well, you need to eat better, you need to eat this and this, but you get home and like, I don't know what to make, I don't know how to make it. So he's meeting with a dietitian, so she's going to give some meal ideas. So what are some meal ideas you may suggest? Some resources that can be used to help quit smoking. So the answers for stage 3 are you need to quit smoking, you want to eat a healthier diet and exercise daily. A lot of times when you're doing well and you're exercising, you really don't want to put that junk in your body. So that's a good little positive reward for it. Check our food labels. Meeting with a dietitian, so you can go over the food labels to where you can understand it. You get a package from the grocery store and you just don't understand it, take it to them, let them kind of decipher it for you. We already talked about limiting the salt and the sodium intake. And some resources we have for quit smoking, you have the American Cancer Society, American Lung Association. There's some resources within your community to kind of help quit smoking. The National Cancer Institute, and even some employers have classes and give you extra benefits for taking the cessation courses. Thank you for listening to our presentation, and hopefully you've learned something.